Welcome to the TIP TV Health Show. It gives me great pleasure to introduce Dr. Charlie Easmon. I got that right this week. He has got more letters after his name than in his name in the art of healthcare. Dr. Charlie from Harley, welcome to the show.
Thanks, Miss.
Right, we've got 6 subjects here. Now, again, I'm a simple person. These are areas that are very, very serious for a huge amount of people. I thought I'd keep it simple. I'm a bit embarrassed, a bit shy to ask a number of these questions, okay? So bear with us. If you want something covered in the future, get in touch with us at TIP TV and we'll make sure Dr. Charlie covers them on shows in the future. Let's kick off with the first subject, Dr. Charlie, hypertension and stroke. What are they? How do you get it? How do you avoid getting it?
Okay, well, Moose, let me start with a personal story. I've got an older brother who's half brother, 10 years older than me. He was in St George's Hospital. He had a severe dense paralysis down his left side. He had difficulty speaking and they had to look after him in hospital for about 6 weeks, and I visited him regularly. So that's a classic stroke where you end up paralyzed down one side of the body, or it affects your speech, or it affects your ability to think. And what's happened there is effectively it's as if a gasket has blown in the brain, right, and an area of the brain that was previously supplied with blood is no longer supplied and then gets damaged and has all those effects secondary to that.
Okay.
So the classic thing with hypertension, it's as if you've got a setting on a valve that's way higher than it should be. So while that setting is high, you may not even know that you've got it, but at some point something's going to blow.
Right, so what causes these gaskets to blow?
Very good question. The first thing with hypertension, in most cases, surprisingly, we don't even know what's causing the hypertension. So in about 95% of people, we call it essential hypertension, which basically is our medical way of saying we don't know what the cause is.
Right, okay.
But what we do know is it does run through some families. It is more common in certain ethnic groups, especially the African Caribbean community. Interestingly, there's even a slavery hypothesis. No one will be able to prove it. The hypothesis was that to survive the Atlantic, those slaves who had higher blood pressure were the ones who survived the journey, and maybe then it was passed down. But you'll never be able to prove a theory like that.
Right. And in terms of a stroke?
Yeah, well, what happens is 10 or 20 years of that constant high pressure weakens the vessels effectively,
right, okay,
and that's what leads to the gasket being blown.
Understood. Now, somebody's watching, they work in a very, very busy trading room, they've got a very busy working life, let's say. What can they do to basically try and alleviate that going forward?
And I'm really glad you mentioned traders, because what are traders good at? They're good at numbers. And hypertension is about numbers. That's all it is. So everybody should make sure they know what their blood pressure is. What is the number? Now, I can tell you what the bad number is. The bad number is above 140 for the higher figure and above 90 for the lower figure. So every single person should know what their number is, and they should make sure they regularly check that number.
What's the definition of regular?
Okay, I think that I would do it every 3 months or so. I'm a great fan of the fact that you can now buy devices from Boots or any chemist. You can go and buy an Omron device, you can go to an Apple shop and buy a Withings device, and these things, some of them can connect to your iPhone. They give you the number. Even if you don't know what the number is, you can email it to a doctor or your GP and say, look, is this the right number, or should I be worried?
So there's no excuse not to do it.
Absolutely, no excuse not to do it.
Cheaply.
Absolutely. And Moose, you know, one of the things I find incredibly funny, a lot of guys, they're proud of the fact they've never visited a doctor. There's nothing to be proud about. They should know their blood pressure.
But people, and I've said this, okay, are fearful of going to the doctor, the dentist, and the likes.
Okay, well, I've seen the tail end of fear. And the tail end of fear is paralysis or inability to speak or a ruined life. Now, if you're a trader, you're in business, whatever, you want to retire successfully. You do not want to be the dribbling person walking with the Zimmer frame by choice.
That's your first TIP TV lesson today. Let's take a quick break, then we're going to come back and talk about diabetes.